My name is Katie Hubbard. I'm the Wellness Coordinator for University of Michigan Health Plan. As your host and speaker today, it's my privilege to welcome you to today's webinar in recognition of American Heart Month on Know Your Numbers. So this is a whole presentation on what your numbers are and how we can reduce your risk for cardiovascular disease. We are going to be recording this webinar today, so your audio will remain muted for the duration. If you have questions at any time, please feel free to type those in the chat, and I'll do my best to kind of answer them as we go. So I'm going to pull up my presentation here. Okay, should be able to see the window. Okay, awesome. So like I said, today we're going to cover cardiovascular disease, like a very quick 30-second overview of what it is, the modifiable and non-modifiable risk factors. So the things that increase your risk for cardiovascular disease, the numbers that you need to know, and then how to reduce your risk. So as I was kind of diving into like what the numbers are, there was like some key patterns that emerged on certain lifestyle changes that really help to target multiple of those risk factors. So we're going to go into that. Today's webinar is going to be a pretty quick overview. So if you have questions, feel free to reach out afterwards, but I hope the information is helpful. So cardiovascular disease refers to a wide group of conditions that affect the heart and blood vessels. It includes coronary heart disease, which is typically what we think about when we think about like a heart attack. That's the narrowing or blockage of the arteries that supply blood to the heart. A stroke, and obviously like that would be a blockage or rupture of one of the arteries that supplies the brain with oxygen. The high blood pressure, valve disease, congenital heart defects. There's like a whole host of diseases that are kind of grouped under the umbrella of cardiovascular disease. So primarily, when we think of cardiovascular disease, we think typically of coronary heart disease or coronary artery disease, which is like more of that classic chest pain, chest pressure resulting in a heart attack. But there's lots of conditions that are kind of grouped underneath this umbrella as well. Cardiovascular disease causes half of all deaths in the US and is a leading cause of death globally. So it's really important to kind of dive in to figure out how we can reduce our risk for this. We know stroke is one of the leading causes of disability worldwide as well. And so again, lots of good reasons for trying to improve our health and well-being here. This just kind of shows a little bit of a picture of how that blockage in the artery can cause a heart attack. So you can see the little black dot there. Again, it's occluding the blood flow to the portion of that ventricle that is responsible for pushing out blood to the rest of the body. We want to make sure that our coronary muscle or heart muscle, most of all, gets the oxygen that it needs. So a blockage, either whether plaque ruptures and causes a blockage further down, or whether it's a blood clot that causes a blockage, that buildup of fat within the artery wall can just increase the risk for that. And obviously any damage to the heart and blood vessels can be challenging to work back from. You know, cardiac rehab plays a critical role in helping people regain their strength following a cardiovascular event. But we want to prevent those things if we can from happening in the first place. So the good news with risk factors is we've kind of figured out what things are going to increase the risk for cardiovascular disease. And a lot of these things can be reversed. And so, you know, we know that there are certain changes that we can make with our lifestyle that can help reduce some of the plaque buildup in the arteries, can help lower blood pressure, lower cholesterol, and address some of these factors that are changeable. So there's ones that we can affect, like we can stop smoking, we can lower our blood pressure, we can improve our cholesterol levels, we can be more physically active, we can reduce our weight, especially like abdominal waist circumference. We know that it has a higher risk for cardiovascular disease. We can lower our blood sugars and decrease our risk for diabetes. Things that are non-modifiable, as we know, as we get older, our risk tends to increase. If you have a family history, meaning a close family relative that has been diagnosed with cardiovascular disease, you're going to have an increased risk. Certain races also have a higher risk of cardiovascular disease. So those are things that you want to be aware of, but then, you know, focus on the things that we can actually change. We know that as the the number of risk factors increases, so does the risk. So this is not going to be a huge surprise to you. But 3 major risk factors increases the risk by 8 times that of someone who doesn't have any major risk factors for cardiovascular disease. So the numbers that we're going to speak briefly on today are blood pressure, cholesterol, and again, there's several different types, and I want to at least give you an understanding of how you can interpret those. Blood glucose or HbA1c, and then waist circumference or body mass index. So the first number is blood pressure. We know that the blood pressure is the force exerted on the artery walls during the contraction as well as the relaxation phase of the heartbeat. So that's why it's shown as 2 different numbers. The first number is the pressure on the arteries during the contraction phase, and the second number of your blood pressure is the pressure on the arteries during the relaxation phase. Regular elevated blood pressure causes a lot of damage to your heart and blood vessels, especially for like smaller organs like eyes and kidneys. Sometimes hypertension is called the silent killer because you don't know that your blood pressure is elevated unless you're having it checked until you have it checked. And that's why it is so important to have it checked consistently. So next time you're at your doctor's office or you run into like CVS and they have the little automatic machine, just check it and find out where your reading is. Ideally, there are some very helpful guidelines, and those are going to be linked in the sources as well. You want to sit for 5 minutes. You want to do it at home when you're relaxed. You want to be sitting. You want to have your arm elevated about heart level, legs uncrossed. So these are things. Think about how your doctor has you positioned when you're at the office. So try to replicate that at home as possible when you're checking your blood pressure. If you're able to do it on a home cuff, that might be the best because you might actually be the most relaxed during that reading. But these are our guidelines. So ideally, you want your blood pressure less than 120 systolic and less than 80 diastolic. The lower, the better, typically within range. And again, work with your doctor on that one. Too low can cause lightheadedness and other issues. But, for most people, shooting for that less than 120 and less than 80 is a great place to shoot for. If you are consistently running in the 140s or 90, it's something that you definitely want to have a conversation with your primary care provider about. So this is something, again, over time it's hard on your heart, hard on your blood vessels, and we don't want to cause, especially for damage for your eyes, retinopathy, kidneys, kidney disease. Those are things that are can be more likely for someone who has a rampant, undiagnosed, uncontrolled high blood pressure for a period of time. Our second number is cholesterol. So we know that our elevated cholesterol levels can increase the risk of atherosclerosis, which is actually like a type of cardiovascular disease. It develops when the plaque builds up in the arteries. It narrows the walls, making it harder for blood to flow through. And also, if a blood clot forms, it can block that blood flow completely through that artery, or the plaque itself can even rupture and cause blockages further down. So we know that the HDL cholesterol is the good, and that helps take your plaque from your arteries to your liver to be broken down and metabolized. So that is great. In fact, the higher that is, the better. LDL is the bad cholesterol, and again, that is what causes the plaque buildup, and that can cause hardening of the arteries, and it just narrows the path that the blood has to travel through. So it increases the pressure. Sometimes it can increase the strain on your heart. These are just a breakdown. And again, I'm going to send these slides out afterwards, so you'll have them for what to kind of look for. Triglycerides are just a fat that circulate in our blood. LDL and HDL are probably the most important numbers of this screen that you want to look at. Again, if your total cholesterol is like, let's say 220, and your HDL cholesterol, which is your good cholesterol, is like 80, your primary care provider may not be as concerned if your LDL is within a normal range. Because even though your total is a little bit up there, because your HDL is so high, it's going to reduce that ratio. So that HDL to total cholesterol ratio is going to be within an optimal level. So definitely want to look at the whole picture when it comes to cholesterol. Again, if that HDL cholesterol, which is what's like taking the fat and the plaque out of your bloodstream and moving it to your liver so it can be removed, if that's elevated, that's a good thing. And that means that your risk for cholesterol is going to be lower. Whereas the LDL, that's just what causes the plaque and fatty deposits in the arteries. And so we want to maintain that less than 130, less than 100. If you have diabetes or other cardiovascular disease risks, your cardiologist or your primary care provider may have a different target for you. So again, these are just like general guidelines that have been established, but you may have like a target of like 70 or 100, for example. For blood glucose, which is our third number, diabetes is really increasing in prevalence. And we know that there's a strong connection between diabetes and heart disease. So adults with diabetes are 2 to 4 times more likely to have heart disease or a stroke than those without. So we really want to keep an eye on our blood glucose. And when we talk about blood glucose, we're looking at typically our fasting blood sugar or our HbA1c, which is like a 3-month indicator of longer term blood glucose control. So your primary care provider may have you do a lipid panel and add in a blood glucose. They may add in an A1C just to kind of get a better handle on how your blood sugars are running and if you're trending on the higher side, just so they can get out ahead of it. There's a lot of really good information on prediabetes, and so there's diabetes prevention programs out there, and a lot of times those programs are offered through your insurance company. So that's something that definitely want to encourage you to reach out if you have questions about, learning more about a diabetes prevention program or the diabetes path program that's offered through Tri-County Office on Aging. So there are some really good programs out there designed to help further reduce risk from blood glucose. But when we talk about those numbers, we want less than 100 for our fasting blood glucose or less than 5.6% for our HbA1c if we're going off of A1C instead of just the fasting blood sugar. Usually you need like 2 confirmed measurements above 126 in order for a diabetes diagnosis. But those are things knowing is helpful because then you know that you want to start making some changes with regard to your lifestyle. And lifestyle changes, especially with diabetes, have been shown to be really effective. Lots of hope there. Number 4 is waist circumference. And we know that the waist circumference or waist to hip ratio, and again, I didn't include the information for waist to hip ratio, although there's a lot in the literature about the value there as well. We know that carrying the weight more as like an apple, that extra visceral fat is closer to the heart. It tends to increase the risk for cardiovascular mortality independent of BMI alone. So, that's a challenge. If you know that your waist circumference is elevated, making some of these changes can help lower that risk, even if the weight doesn't change at all. So that's like, and exercise is one way to help reduce abdominal fat. And not that you can spot reduce, but you can, increase your walking, add more strength training in, just increase physical activity energy expenditure, and that can help reduce waist size. So even if the weight doesn't change, sometimes you're able to see the inches come off. And especially if they come off around the waist area, it's going to decrease your risk even further for cardiovascular disease. So we know that we want to try to decrease that less than 35 inches for women, less than 40 inches for men. There are other certain types of cancers that are also tied to an elevated waist circumference. So that is our third. And then I also kind of combined BMI with that. I had to share this cartoon because I think it's hilarious. But we know that there's an increased risk associated with a BMI above 30. And so you can calculate your own BMI. There are limitations with BMI. For example, it doesn't tell like lean versus fat mass. So if you are exercising regularly and you are going to the gym and you are doing lots of weights, your BMI could be elevated, but your percent body fat might be lower or within a normal range. So again, there are certainly limitations when we're looking at BMI, which is why for this presentation, I kind of grouped it with waist circumference because both of those together give a more complete picture. So how to reduce the risk? Like I said, as I was kind of looking through, how to reduce cholesterol and how to reduce, improve blood sugars and how to reduce blood pressure and reducing risk overall, there were some things some themes that tended to emerge. The first one was with regard to diet. So for blood pressure, sodium is going to come top of mind. We want to maintain a lower sodium intake, which is challenging to do. So the DASH diet, which is dietary approaches to stop hypertension, is really highly recommended and emphasizes fruits, vegetables, whole grains, and low-fat dairy products. And again, just keeping an eye on the sodium. There's sodium that's added to so many different things. So if you can remove as much from your diet as you can, by choosing, other ways like herbs and spices to get the flavor that you're looking for. For cholesterol, the American Heart Association recommends completely eliminating trans fats from your diet. And that means like reading the labels to make sure that there's no partially hydrogenated oils that are added. Sometimes it'll say trans fat 0 grams, but what that means is it means there's less than half a gram per serving. And so if you're having multiple servings of something, you're getting some trans fats unless you're reading the label and just verifying that there's no partially hydrogenated oils there. And then saturated fat of less than 6% of daily calories. So for someone with like a 2,000 calorie day diet, that's less than 13 grams of saturated fat a day. For cholesterol also, we want to increase our soluble fiber. And so just for the purposes of today, increasing fiber intake to 25 to 38 grams, and then limiting that red meat intake. So again, just trying to limit our dietary cholesterol. There is some gray evidence about the link between cholesterol, dietary cholesterol and like cholesterol in the body. We're only consuming cholesterol from animal-based products or byproducts. So your dairy, cheese, eggs, meats are going to contain cholesterol, but like all of your plant-based products and sources of protein are going to be cholesterol free. So, it's good to kind of do your own research and figure out, talk with your provider, talk with the dietitian. These people are going to be good sources of what might be best for you and for your family. For blood glucose, the Mediterranean diet has been shown to decrease our A1C levels and reduce the incidence of type 2 diabetes. So it's one of the things that is typically recommended as part of a diabetes prevention program. And it just emphasizes, like, again, plant-based foods, nuts, beans, seeds, whole grains, fish and seafood, lots of olive oil, dairy products in moderate amounts, and less eggs and less, like not a lot of red meat at all. With regard to fruit, usually a lot of Mediterranean diets emphasize fruit as like the sweet for the dessert. But again, this is just an option. It has been shown to decrease A1C and improve blood glucose control over time. So that might be something to look into if you're interested in learning more about how you can help to lower your blood glucose values. And then all of them agree of increasing consumption of the omega-3 fatty acids. So these are like your walnuts, flax seeds, a lot of the oils, and then also like your fattier fish. So tuna, salmon, halibut, cod. These are ways that you can just kind of increase the consumption of your fatty acids, and that's going to help to also improve cholesterol overall. I'm not a dietitian, so I don't even go into like fish oils or other supplementations. These are things that would be, you could talk more about with the dietitian or your provider about if you're interested on supplements. But foods, you can get these sources through foods as well. And so there's a lot of other benefits that you get with consuming your omega-3 fatty acids through food sources. This is just like the general what to eat. Our whole grains and our oats provide the soluble fiber, which helps to lower cholesterol. Our fruits and veggies, eat the rainbow. Skinless poultry or fish. Steaming is like a really healthy method of cooking because you don't get the carcinogens through like grilling and which, not a talk on cancer, but steaming is healthy. Nuts, low-fat dairy products, and then trying to have some of those healthier oils in our diet as well, while we like cut out the saturated fats, those that are foods that are high in sodium, high in added sugars, limit our intake of fried foods and processed meats like ham and pepperoni, and then limit our sugar-sweetened beverages and alcohol. So those are just the general recommendations for following a heart healthy diet. Those are kind of things that pop out time and time again and have been proven through multiple research studies and evidence. The next thing to help lower and improve our numbers is regularly engaging in physical activity. I'm sure this comes as no shock to any of you. So if your fitness level is low, just start out with shorter sessions, 5 to 10 minutes, gradually work up. The aerobic activity has been tied to the greatest benefits. And so we're shooting for 150 minutes of moderate intensity aerobic activity per week, or the higher intensity stuff, or some sort of combination. Add in the strength exercises at least 2 days a week if you can. And then if you like, if blood pressure is a concern for you, like I would encourage you maybe to like do some mind body exercises for stress management. So that's like, again, this is not like a one size fits all, but like pick and choose, pick what's fun for you. So if you could just do less time sitting and you are going to do some gardening and some walking and some yoga and Tai Chi, figure out what works for you. It should be ideally fun and sustainable. So again, you'll be more likely to stick with it if it's fun. The more days, the better. The less time sitting, the better. So hopefully that gives you an idea. These are specific ways that regular exercise can improve or decrease your cardiovascular disease risk factors. So there's lots of reasons that exercise, because it affects not just blood pressure, it affects like all of the risk factors, honestly. It affects blood pressure, affects cholesterol, it raises the HDL, it affects your insulin sensitivity. It helps if you're active, especially after a meal, you're gonna improve or increase your glucose uptake through your GLUT4 transporters, which are in your muscles. And so again, you're gonna lower your blood sugar without using insulin. So going for a walk after lunch, go for a walk after dinner, even if it's only 10 minutes, you'll get some benefits there. It also decreases inflammation. So win-win. Everyone saw that coming. Weight, so again, to decrease waist circumference and to lower BMI, it's just increasing our activity either through aerobic activity or strength exercises, and then reducing our total caloric intake by consuming a diet lower in fat and refined sugars and higher in complex carbs, proteins, and fiber. So this is just a slow, gradual thing typically, and even a 5 to 10% loss in body weight can decrease the risk. So lots of benefits here. There is a body weight planner that I thought was an interesting resource. I tried it. The National Institutes of Health offers this. It helps you determine the number of calories that you should eat each day to get to your goal weight. Like you put in the date that you want to get your goal weight by. Again, like think long term. So like 6 months. I think I did like, is in my example, I did like 8 months or something. So it'll tell you how many calories a day to eat to get there, and then what to eat to maintain it. So it's an interesting tool. But there's a lot of things that influence our eating. And this, if you've not read this book, I love it. It's fascinating. Dr. Weinstein talks about how there's lots of factors that we don't realize influence our eating. Like each person makes like 200 food-related decisions a day. And there's lots of things such as like how many options there are at Thanksgiving that influence how much food we consume or how many calories we consume. The Super Bowl party, how many different types of snacks there are will actually subliminally influence how much you consume. Your expectations of the thing, like if you're going out to a date night, that's like a, again, subliminal cue that may affect how much you eat, what type of food you order, all of that. So he was looking at some environmental factors. So like, what happens if there's no like tomato soup left in the bottom of your bowl? Like that's a cue that you stop eating. So they did one experiment in this book where they talk about how they like piped in soup through the bowls and people weren't aware of it because these tablecloths, and they had some elaborate contraptions. People ate more. So no shocker, but one of his most famous is the popcorn study. And it's like pretty early on in the book, but essentially they treated everyone in the theater to a bucket of popcorn. And some people got a medium-sized bucket and some people got a large-sized bucket. And it will be no surprise to anyone, but the people who got the large bucket ate more, like 53% more than the people who got the medium-sized bucket. So what they are finding is that these subliminal cues can influence how much we eat. So what does this mean for us? if you are plating your food, instead of choosing a dinner plate, maybe consider like choosing like a salad plate or a smaller plate so that your brain looks at it and it looks like more food than it is. If you're going to have some ice cream after dinner, instead of getting a regular bowl, maybe get like a small cup, and then you put your scoops in, and it's going to fill up faster, but your brain will look at that and see more food. So try these, see if they work for you. Um, you can also try smaller utensils. That's another tool in your tool bucket, so to speak. But figure out if you can use little subliminal ways that you can subtly influence how much you're eating. But this one was interesting to me. The next one is don't smoke or use tobacco. So smokefree.gov has a ton of resources, but this is the one I should have started with, but I'm hoping that no one smokes or uses tobacco. So hopefully this is like a moot point. 1 out of every 4 deaths from cardiovascular disease are tied directly to tobacco use. So don't do it. It affects like everything, but really it makes your blood thicker and stickier. And it increases the hardening of your arteries and the plaque buildup of your arteries. And so just the hardening and the narrowing and the hypercoagulability of the blood make a really not good combination for cardiovascular disease. So it raises risk for cardiovascular disease and stroke 2 to 4 times compared to not smoking. In addition to cardiovascular disease, it also is tied to 12 different types of cancer. So you'll feel better if you quit as far as your lungs, but also you'll decrease your risk significantly like everywhere else. It reduces the risk of premature death as much as 10 years by adding 10 years to your life expectancy. So definitely a good thing to cut back on, and with the goal of quitting entirely. And again, like I said, smokefree.gov has a lot of resources. I think the one that we were just on, Quit Now, the CDC website, there are multiple tools here. There's medications that can help people quit. Vaping also has some of the same risks. So I should have said like tobacco and vape pens. There's risks tied to all of them. It is a little different with vaping, but there's significant risks there as well. Stress management. So again, this is another thing that is going to help lower your cardiovascular disease risk. It will help lower blood pressure. It is tied, chronic stress can increase our inflammation. It elevates our blood pressure and it can lower our good HDL. So that's kind of how it got looped in specifically with how do we improve our numbers. It also can attribute to poor diet, poor sleep, alcohol use, and being less physically active. So there's other things there that can be contributors to cardiovascular disease as well. Spend time outdoors if you can, practice gratitude, seek out the things that make you happy. So if you have hobbies, spend time doing them or plan when you can do them. It will do wonders for just helping to maintain a positive outlook. Even if you don't have time, just taking a few minutes and doing some deep breathing. That deep and diaphragmatic breathing takes hardly any time at all, and it can help switch on that parasympathetic nervous system, which helps clean out some of the cortisol, which is one of the stress hormones that kind of builds up in the body over time, and helps switch us over to that relaxation response. It kicks us out of that chronic sympathetic fight or flight. So the deep breathing doesn't take long, and you can do it about anywhere. But ideally, hopefully you're finding other ways that you can regularly engage in stress management practices, whether it's exercise or I'm doing pottery. I love it. It's how I practice stress management, and it also gives me time to think about things that I'm grateful for, and spend time listening to music that fills me up. So you find what it is for you, and then chase after that. Oh, I am whew. Last but certainly not least, this is as important as anything else, and one of the best ways to get your lab numbers to begin with: form an effective relationship with your primary care provider. So that is you and them. Talk about your concerns, your family history. Your primary care provider is one of the best resources that you have for maintaining your health and well-being. And so, know what the recommendations are as far as your preventive health and screenings. Take your medications as prescribed, If you have concerns about medications or you have concerns about, your lipid profile, and maybe you haven't had your A1C checked in 3 years, or you haven't had a fasting blood sugar, talk with your doctor about that. It's so important that you can empower yourself and then use that partnership so that you can kind of maintain your peak health and well-being, because we want to maintain those years of good health for as long as possible. So you can take care of our loved ones, spend time with the ones that we love, and then obviously be able to enjoy our later years of life. So yes, that's a lot of information. Can you tell I was excited? I'm going to stop sharing my screen real quick because I realize I can't see any questions. The diet, okay, there's a question, super. We'll bring back their demo kitchen noon session. I don't know, but I will ask and I will send an email asking for that because I would also love it so much. I loved eating the food. They were wonderful. So thank you for that suggestion. Are there other questions? I do also have a list of sources and resources. Some of them I put on the slides, but when I send out the slide deck, you'll be able to see the sources as well. That way, if you have questions, you can click on them, learn more. It's kind of a mix match of everything. Yeah. Okay, well, I'm over. Thank you for your attention. Thank you for coming. I'll send the slides and the link to the recording in case you have anyone that you'd like to share it with. And I will send along your message about the demo kitchen because I too miss the cooking demos and they are wonderful. Thank you, guys.